Assalamu alaikum dear students. Welcome to Dr. Roomi lectures. Today we are going to study a very important topic from nerve and muscle physiology, and this is resting membrane potential. Resting membrane potential is the potential difference across cell membrane at rest, which means when an excitable tissue is not conducting an action potential. There are two types of excitable tissues in our body. One is muscle and the other one is nerve, and the resting potential is important for these two tissues. Actually, almost all cells in our body, they have resting potential, but only those tissues which are able to conduct action potential, it's important for us to study resting potential for those tissues. Let's suppose this is a cell, and every cell of the body is bounded by a cell membrane. The resting potential, conventionally this is considered inside of the cell, and the value of resting potential for large nerve fibers is minus 90 millivolt, which means that inside of this cell is 90 millivolt more negative as compared to outside of the cell. So keep in mind the resting potential is actually potential inside of the cell as compared to outside of the cell. Resting potential is present in almost every cell of the body, but it is important for two types of tissues, nerve and muscle, which are excitable tissues. And what is meant by excitability? Excitability means, the term excitability means when we give a stimulus to a tissue and that responds in the form of action potential, which means that after giving a stimulus, the resting potential moves towards action potential. And this excitability is seen in nerve and muscles. The other two types of tissues, the epithelium and connective tissue, they are not excitable. Now let's talk about the factors which contribute to the generation of resting membrane potential. There are three important factors. Number one, contribution by the potassium diffusion. Number two is contribution by sodium diffusion. So contribution by sodium diffusion, and number three is contribution by the electrogenic nature of sodium potassium pump. These are three contributors to the generation of resting potential. Just for the sake of teaching, we will consider resting potential for large nerve fibers. The value of resting potential for large nerve fibers and skeletal muscle is minus 90 millivolt. Actually, this value of resting potential is not same for every tissue, it varies. For example, this value is minus 70 millivolt for the cell body, and for smaller nerve fibers, this value is about minus 50 millivolt for smooth muscles and minus 55 millivolt for the SA nodal fibers, which is not stable. It moves itself from minus 55 to minus 40, and that contributes to the autorhythmicity or the automaticity of the SA nodal fibers of heart. So keep in mind the value of resting potential is not same for every excitable tissue. It varies. And just for the sake of teaching, we are considering the resting membrane potential of large nerve fibers, which is minus 90 millivolt. And we will see the proportional contribution of each of these three factors in the generation of resting potential in large nerve fiber or in the skeletal muscle fiber. Now, let's draw a diagram of cell membrane and we will see the role of sodium and potassium in the generation of resting potential. Let's suppose this is a cell membrane. Here, this is outside of the cell, which is having extracellular fluid, and this is inside of the cell, which is having intracellular fluid. Two importance are very important for the generation of resting potential. One of them is potassium and the other one is sodium. So it's important for us to see the concentration of these two ions outside and inside of the cell, and also the channels through which they pass. One very important channel through which potassium diffuses is potassium leak channel. This is also called as potassium sodium leak channel because this also allows some sodium to pass through. We can call it a leak channel, potassium leak channel or sodium potassium leak channel. It allows potassium to pass through, and because the concentration of potassium is more inside of the cell, so that's where potassium will pass from inside of the cell to outside of the cell. Now, what is the relative concentration of sodium and potassium outside and inside of the cell? The concentration of potassium outside of the cell is only 4 milliequivalents per liter. So this is the unit to express the concentration of potassium and sodium, and the concentration inside is 140 milliequivalents per liter. The concentration of sodium outside of the cell is 140 or about 142 milliequivalents per liter, and the concentration of sodium inside is only 10 to 14 milliequivalents per liter. Now if you see the ratios of these ions out and inside of the cell, 140 to 4 is a ratio of 35. So it means the potassium inside of the cell is 35 times more as compared to outside of the cell. This creates a very high gradient of potassium, and this tends potassium to flow from inside to outside of the cell because diffusion occurs along the concentration gradient. So potassium diffuses from its higher concentration of 140 to 4 milliequivalents per liter from into outside of the cell, and this passes through the potassium leak channel. Why do we call it a leak channel? Because it does not have a gate. It's open all the time. There is another type of channels in our body which are called as gated channel, either ligand gated channel or the voltage gated channel. Ligand gated channel, they open when some chemical binds to them. For example, acetylcholine gated channels. And the other types of channels, they are voltage gated channels which open only when there is some voltage change inside of the cell. For example, voltage gated sodium channel which are responsible for depolarization, and the voltage gated potassium channel which are responsible for repolarization. The ratio of sodium outside to sodium inside of the cell is about 10 times, which means that inside this is about 10 times ratio. These are two ratios of sodium inside to outside. So the inside sodium is 10 times less as compared to outside of the cell. So you can see here that once again there is a gradient, and the gradient for sodium is to flow from outside to inside of the cell. So this is why when sodium diffuses through these leak channels, it moves from outside to inside of the cell. Because this leak channel allows both sodium and potassium to pass through, so that's why this leak channel is also called as potassium sodium leak channel. Now another very important concept which we need to consider to understand resting membrane potential is the relative sizes of sodium and potassium. What is the atomic weight of sodium? For sodium the atomic weight is 23, and the atomic weight of potassium is 39. Absolute size of potassium is bigger as compared to sodium. So if this is the absolute size of potassium, here this is the absolute size of sodium, which means that as per atomic weight, sodium is smaller as compared to potassium. What about their charges? Both of them are monovalent, and they are having positive ions, monovalent cations, and both of them they are having a charge of 1 plus. So which one is having more charge density? Density means how much charge is present in a smaller volume, because sodium in a smaller volume has the same charge as compared to potassium which has also similar charge in a larger volume. So we can say that the charge is more dense in sodium as compared to potassium. Because of higher charge density of sodium, it will attract more water. So when we dissolve both of these ions in water, the hydrated size of sodium will be bigger as compared to the hydrated size of potassium, because the ion which is more charge dense, that will attract more water. These are all water molecules around sodium. So the hydrated size of sodium is bigger than the hydrated size of potassium. So practically speaking, in our body, the hydrated size of potassium is smaller as compared to the hydrated size of sodium. So both of these ions, because they have to pass through the same leak channel, they will compete with each other. So which one will be easier to pass through this leak channel? What do you say? Sodium or potassium? Here the hydrated size will matter, and the hydrated size of potassium is smaller. So that's why it will be easier for potassium to diffuse through this leak channel. And this is why the permeability of potassium is 100 times more than the permeability of sodium. So I repeat, permeability of potassium is 100 times more than the permeability of sodium to pass through the same leak channel. And this is the reason why potassium contributes much more in the generation of resting potential as compared to the diffusion of sodium. It's a very important concept to understand. The first concept was, what is a leak channel? This is potassium sodium leak channel. Both sodium and potassium ions they pass through this channel. Second important concept to understand for you is the concentrations of sodium and potassium out and inside, and what are their ratios, and what is the direction of their gradient. The direction of gradient for potassium is from in to outside, and the direction of gradient for sodium is from out to inside. And third important concept for us to understand is the relative sizes of sodium and potassium. The hydrated size of potassium is smaller as compared to the hydrated size of sodium, and this is why it's much easier for potassium to leak or to diffuse through this sodium potassium leak channel, and this is the reason why potassium contributes much more in the generation of resting potential as compared to the diffusion of sodium. Okay, so after studying the nature of sodium potassium leak channel, the concentration differences of sodium and potassium out and inside of the cell, and also the size of hydrated ions and their permeability through the cell membrane. Now let's talk about the role of their diffusions and how the diffusions of both of these ions is responsible for development of diffusion potential across cell membrane. Let's suppose if our cell membrane is permeable to potassium only, so potassium will diffuse from inside of the cell to outside of the cell along its concentration gradient, because potassium is more concentrated inside of the cell as compared to outside of the cell. So this is the diffusion of potassium along its concentration gradient. Every time when one potassium ion moves from inside to outside, there is development of one negative charge inside of the cell. So if potassium keeps on moving from in to outside, more and more negative charges they will develop inside of the cell. This is because when one positive potassium is diffusing outside of the cell, it leaves negative protein ions behind, which cannot diffuse through the cell membrane. And when this negative charge is developing inside of the cell, at the same time positive charge is developing outside of the cell. And now another force will develop, which is called as diffusion potential, because it develops because of diffusion of the potassium ion. And the direction of this diffusion potential will be from out to inside, because when potassium is moving outside, so positive charge will develop outside of the cell and negative charge will develop inside of the cell. So direction of this diffusion potential is from positive to negative, and this is towards inside. When more and more potassium flows outside of the cell, more negativity develops inside of the cell. When this diffusion potential of potassium becomes equal and opposite to its concentration gradient, then both of these forces they cancel the effect of each other, and there is no more diffusion from inside of this cell to outside of the cell for potassium. And at that time, this diffusion potential is called as equilibrium potential, because equilibrium is reached. And this potential is also called as Nernst potential. The value of Nernst potential for any given ion can be calculated by using this equation, which is called as Nernst equation, and the formula is electromotive force in millivolts is equal to plus minus log concentration inside for that specific ion and divided by concentration outside. Here you can see the concentration of potassium inside of the cell is 140 and the concentration outside is just 4. The ratio of these two is 35. So the log of 35, here you can say log of 35, because ratio of 140 to 4 is 35, so log of 35 is 1.5. So log of 35 is 1.5. When you multiply this 1.54, which is log of 35, with 61, the answer is 94. What is the sign of this 94, whether plus or minus? It will be logically determined. You can see here potassium is a cation, it's diffusing from inside to outside of the cell and leaving negativity behind. So this resting potential, which is taken conventionally inside of the cell, inside is minus 94 millivolt. So you can say that the diffusion potential or the Nernst potential for potassium is minus 94 millivolt. And because our membrane is highly permeable to potassium, this leak channel allows 100 times more permeability for potassium as compared to sodium. So that's why when the leak channels allow diffusion to potassium and sodium at the same time, minus 94 millivolt is the contribution of potassium diffusion in the generation of resting potential. So minus 94 millivolt is the contribution of potassium diffusion in the generation of resting potential. Now let's suppose our membrane is permeable only to sodium. And you know very well that sodium is more concentrated outside of the cell as compared to inside. Sodium diffuses from outside to inside of the cell. And every time when one sodium ion diffuses from out to inside, it brings one positive charge inside of the cell. So the diffusion of sodium will create positivity inside of the cell, and this diffusion potential for the sodium, gradually it will develop. The direction of this diffusion potential is from in to outside, because when sodium will move inward, inside will become positive and outside will become negative, and the direction of any diffusion potential is from positive towards negative. When this diffusion potential for sodium becomes equal and opposite to the concentration gradient, then these two forces, they cancel the effect of each other, and then we say equilibrium is reached. At that time, the diffusion potential is called as Nernst potential. So you can define that Nernst potential is that membrane potential at which the diffusion of any certain ion does not take place, because the diffusion potential and the concentration gradient, they cancel the effect of each other. The value of Nernst potential for sodium can also be calculated by using the same Nernst equation. Here we just have to change the values. First we have put the values of potassium, here we have just placed the values for sodium. The concentration of sodium outside is 140 or 142 and inside is 14. So this ratio of 14 to 140 is 10. So 1 over 10. And the log of 1 over 10 is the ratio between concentration of sodium inside to outside. That means 0.1. And the log of 0.1 is equal to -1. When you multiply the 61 with -1, the answer is 61. And once again, the sign for this Nernst potential will be logically determined, because sodium diffuses from out to inside. It's a positive ion. So positivity coming inside the cell will create Nernst potential inside, which will be positive. So we can say that the Nernst potential for sodium is positive inside of the cell, and the value is plus 61 millivolt. But the contribution of sodium diffusion in the generation of resting potential is not plus 61 millivolt. Why it is not plus 61 millivolt? Because both sodium and potassium, they compete with each other to diffuse through the same leak channel, and because this leak channel is 100 times more permeable for potassium as compared to sodium, because of competition, the potassium will win, and potassium will be able to achieve its whole of Nernst potential, which is minus 94 millivolt. Because first we were assuming our membrane is permeable only to potassium, and also our membrane is permeable individually only to sodium. Now practically in our cell, our membrane is permeable both to sodium and potassium. In that case, these sodium and potassium, they will compete with each other to diffuse through the same leak channel, potassium from in to outside and sodium from out to inside. And because potassium is 100 times more permeable, that's why potassium will be able to achieve whole of its Nernst potential value, which is minus 94 millivolt. But sodium will not be able to achieve whole of its Nernst potential value. It will achieve only plus 8 millivolt out of this 61 millivolt. If someone asks you how much is the value of sodium Nernst potential, the answer is 61 millivolt. But how much is the contribution of sodium diffusion in the generation of resting potential? Then the answer is only plus 8 millivolt. It's because of competition between the sodium and potassium to pass through the same leak channel, because the hydrated size of potassium is much smaller as compared to the hydrated size of sodium. So potassium has 100 times more permeability to pass through the same leak channel as compared to sodium. Now I will write it here that the contribution of sodium diffusion in the generation of resting potential is only plus 8 millivolt. There are some other ions as well which may play a little bit role in the generation of resting potential, like chloride. And the total share of all of these ions, sodium, potassium and chloride, in the generation of resting potential can be explained by using an equation which is called as Goldman's equation. According to Goldman equation, for each specific ion, two factors are responsible for its contribution to the generation of resting potential. One is the concentration difference of that specific ion inside and outside of the cell, and the other one is the permeability for that ion to pass through the cell membrane. Here three ions have been considered: sodium, potassium and chloride. And this equation takes into account both the concentration of any specific ion are inside and outside of the cell, like for sodium, and also its permeability. Similarly, concentration of potassium inside and outside of the cell and its permeability. For chloride, the concentration is reversed. Here concentration of chloride is outside and then inside, and also the permeability for chloride. According to Goldman equation, once again, the contribution of these three ions in the generation of resting potential is minus 86 millivolt. And this is the same contribution which is net contribution of potassium diffusion through the cell membrane and sodium diffusion through the cell membrane. Here you can see the most of contribution in the generation of resting potential is that of potassium diffusion through the cell membrane, and second number is the diffusion of sodium through the cell membrane, and the sum of both of these factors is equal to the contribution of all of these three ions, that is minus 86 millivolts. So it means chloride has minor role in the generation of resting potential. Third important factor which plays its role in the generation of resting potential is the electrogenic nature of sodium potassium pump. You already know that sodium potassium pump is responsible for throwing three sodium ions outside of the cell, and it brings two potassium ions into the cell. And this sodium potassium ATPase pump, because it takes three positive ions outside of cell and bring two positive ions inside of the cell, 3 minus 2 is equal to 1. For every cycle, there is loss of one positive ion from into outside, and it will create negative charges inside the cell. And that negativity, which is contributed by the activity of sodium potassium ATPase pump, is minus 4 millivolt in the generation of resting potential. So minus 4 millivolt is the contribution of sodium potassium pump because it creates negativity inside of the cell because of its function. So that's why we call it electrogenic pump. Now if we sum up all these three factors which contribute to the generation of resting potential, the answer is minus 90 millivolt. You can see here minus 90 millivolt is the net resting membrane potential in larger nerve fibers. Please don't be confused. This value of resting potential is variable. It differs in different tissues. For larger nerve fibers and for skeletal muscle fibers, this value is minus 90 millivolt. For smaller nerve fibers, this value is minus 70 millivolt. For cell bodies, minus 70 millivolt. For SI node of heart, minus 55. For smooth muscles, it's minus 50 millivolt. And because of change in the contribution of these three factors, the value of resting potential will be different in different tissues. If someone asks you in examination which one is the most important contributor in the generation of resting potential, then what should be your answer? The answer should be potassium diffusion through the cell membrane, because potassium is highly permeable. When it diffuses through the membrane, it is able to achieve whole of its Nernst potential, which is minus 94 millivolt. So this is the biggest contribution to the generation of resting membrane potential. And this is why whenever the potassium level fluctuates, when it becomes higher or lower, it has effect on the resting membrane potential. I will give you an example to explain that potassium is a very important contributor in the generation of resting potential, and the fluctuation of potassium both higher and lower in the extracellular fluid, it affects the resting membrane potential. Let's suppose potassium becomes less in the extracellular fluid, then what will happen? Because potassium has become less in the extracellular fluid, so it will diffuse from inside of the cell to outside of the cell. Normally potassium diffuses from into outside, but because it becomes less here in the extracellular fluid, the diffusion of potassium from in to outside will be more. And because more potassium will be leaking from in to outside, this diffusion of potassium will create more negativity inside of the cell. And the value of resting potential will become even more negative. If normally the value of resting potential is minus 90, in this case the value of resting potential may become like minus 100. And this hyperpolarization in the cell membrane, it will inhibit the cell. And this is why we feel fatigue when there is low level of potassium in our extracellular fluid, because our excitable tissues like our nerves and muscles, they are inhibited. Here I would like to link this role of potassium with the cardiac physiology. Sometimes a cardiac patient is taking several drugs, and some of those drugs, they affect the electrolyte concentrations in our body, like some drugs can increase or decrease the potassium levels. So it's a very important point for you to remember as a clinician that any drug that affects the level of potassium, whether increases it or decreases, can affect the function of heart, can cause arrhythmias. So if you are asked in examination which ion or electrolyte is most important to monitor in a patient of heart disease who is taking multiple drugs, if your options are sodium, potassium, chloride, bicarbonate and calcium, the answer is potassium. So for cardiac patients, the most important ion to monitor is potassium. Both higher and lower levels of potassium can cause arrhythmias. So this is why potassium level must be monitored in cardiac patient who is taking multiple drugs. So I hope you have understood this very important topic of resting membrane potential. And once you know this topic of resting potential, it will become much easier for you to understand the topic of action potential. So thank you so much for watching this video. See you next time with another video.